Okay, Sharon, so Mum's got everything organised. She's packed the bags, she's practised the journey, she knows where she's going. Now she's feeling that baby's on its way. Should she go straight to the maternity unit?
No, not straight away. What mum should do is contact Maternity Assessment by phone and speak with a midwife. The number can be found in the front of the handheld records, and it's a good idea for mum to have this number on her mobile. The midwife that speaks to mum will ask her some questions about her pregnancy, any previous pregnancies, how she's feeling, and will ask her to describe why she thinks she's in labour. That will let the midwife assess whether mum is actually in labour or not quite yet.
Yes, it's better to know for sure rather than make the journey for no reason.
The advice might be to stay at home for now. Research has shown that this is the best environment for early labour. Use some simple painkillers, maybe have a warm bath, use some of your relaxation strategies, keeping active, and call back in a few hours. However, if the midwife thinks that labour has started, she would ask mum to come to the maternity unit straight away and go to maternity assessment on level 2. Mums should remember to bring their handheld records. If mums have other children, then they should make sure they have made suitable arrangements for childcare before coming to hospital.
So earlier we saw your journey to the maternity unit. Let's go back now and see what happens when you go inside.
So here I am at the Princess Royal Maternity, and the midwife has said it's time to come in. It's just a short walk to the lifts on the left hand side, and you should make your way to maternity assessment, which is on level 2. When you come out of the lift, you should make your way to maternity assessment through this door and follow the signs. Hi, Margaret Ann. Mum's arrived here in maternity assessment. What's going to happen next?
We would be expecting Mum here, and we would confirm her name and her details. Then we'll show her through to where the midwife would then assess her. If you'd like to use some hand sanitizer, then we'll show you through.
Hi there.
Hello, I'm Sharon.
Hi, I'm EA, the midwife. Can I just ask you to use the gel, please?
Certainly.
Thank you.
EA, Mum's arrived in maternity assessment. What's going to happen now?
Well, we're going to do a full clinical examination on the mum. We firstly will assess mum's well-being. We'll check her blood pressure, pulse, temperature, and we'll also palpate her abdomen to see which position the baby's lying in. We also assess the baby's well-being by listening to the heartbeat and recording it on a monitor. We also assess contractions, perform a vaginal examination to check the neck of the womb to make sure it's dilating.
So you build up a complete picture of what stage labour is at. What's going to happen now?
That depends on the assessment, of course. It could be that the mum isn't actually in established labour yet. In that case, we say to her, return home and provide her with some stronger painkillers to take with her. We would advise her to use some self-help measures, have a warm bath, keep active and use some relaxation techniques and wait for labour to become established. It may be decided that labour should be induced. We'd make a plan for that. Mum could go home and come back at the appropriate time. If the midwife thinks the mum is not quite in established labour, but it won't be long or close monitoring is required, then the mum would be transferred to the antenatal ward for further assessment. Their birth partner can stay with them but cannot remain overnight and would have to go home. In any case, the midwife will ensure she has got the contact details. And finally, if the assessment examination confirms that mum is in established labour, then she will be taken to labour suite.
You've used a phrase a couple of times, established labour. What exactly does that mean?
There are 3 things that establishes labour. There's a show, you can have waters breaking and contractions. Show is a plug of mucus which seals the opening of the cervix, and as the cervix begins to soften and prepare for labour, the plug of mucus is released. Show can be a single blob of jelly-like substance, or it can come away in small pieces over the course of several days. Show may not mean that you're in labour, as it can be several days between having a show and labour beginning. Waters breaking. The amniotic sac is a bag of fluid surrounding the baby. When the sac breaks, the fluid escapes, and this can happen suddenly in a large gush, or it can slowly trickle. If you think your waters have broken, then you should make contact with maternity assessment. And contractions. These will only show a sign that you are in labour. If they are coming closer together and lasting longer than 40 seconds, When you feel them coming stronger, closer and more rhythmical, you should phone maternity assessment. Established labour is when the mum is having regular painful uterine contractions and when the cervix is dilated to 4 centimetres.
So the assessment tells the midwife that mum is in established labour. What's going to happen then?
Mum will be taken to labour suite.
OK, can we go and see the labour suite now?
Actually, my colleague is going to show you around labour suite.